Live on Facebook and LinkedIn right now. Hello, everyone. My name is Joe Russo. I am the CEO of the Palm Beach Tech Association, coming to you live on Monday at 6 o'clock for another South Florida Tech Talk. We have periodically of late done these virtual. We typically do these all in person throughout South Florida. And, virtual has been kind of a blessing and curse. Would love to get together in person and see everybody and exchange some ideas, but this also gives us an opportunity to have some really unique topics and speakers. And with that, today we are extremely lucky to have Jupiter Medical Center, one of our members, present today. But that organization is come so far and for so long. But we have their CEO, Dr. Amit Rastogi, with us today, who's going to be talking about leadership in innovative safety technologies. And thank you so much for joining us and for supporting Palm Beach Tech and for everything you do just to, in this day and age, to keep our community healthy. Thank you so much. And, I'm going to let you take it from here and share this knowledge with us, and look forward to listening in.
Joe, thanks very much for the introduction, and really I'm glad to be part of this organization here. And I have to tell you, these are definitely challenging times, but I'm happy to have all the team members at Jupiter Medical Center and everything that they do every day. Just to comment on what you were saying earlier about us, having to resort to virtual meetings as opposed to in person. For sure, in person is always better, but at least this gives us a venue to be able to, get out some much needed information. With that being said, I do have to share with you a comment that I made to my team earlier today, because as we've, at this point gone to an all virtual meeting platform, and I had meetings just back to back from, about 7 o'clock this morning to now, I told my team, I've answered the question today that yes, there is such a thing as too much solitude, as I sat in my office and just had virtual meetings all day. But again, thanks for this opportunity to talk a little bit about technology's impact on healthcare. I think that, all of us know how much technology has evolved within healthcare over the past many years. But I would tell you, I've never seen the acceleration the way that I have certainly over the past couple of months since the pandemic, as we've all heard that necessity is the mother of invention. And we've come to realize that even though the human touch is necessary for us from a healing standpoint, certainly technology plays a big part in how we can pass on and administer some of that healing as we go. Lou, can you share the slides with us? Great. Next slide, please. So I think as you see on this slide here, and even though this looks more like a space-age rocket, what it actually is one of our TrueD machines that helps, and we've got a few of these at Jupiter Medical Center that actually helps us, disinfect the rooms. And what we do is end up rotating it through our operating rooms of the various areas of the hospital, and that allows us to disinfect and clean areas from pathogens such as viruses, and other pathogens as well. And certainly at times like these, that's proven to be invaluable, which is why we until recently had one machine, but with the generosity of our community and our donors, we're able to, advance that to a handful of machines that we have at this point. Next slide, please, Lou.
Having a little bit of technical issue here. Hold on one second for me.
Great. So I think that, as we all think about medicine and technology, certainly none of us think that technology is going to replace the human touch and what doctors do from a medicine standpoint. But we know that as time goes on, technology is incredibly important for us to really be able to deliver the outcomes that we need, right? And in the end, that's what it's about. It's not just about having the process of using technology, but actually being able to use technology to improve outcomes. And then on top of that, how do we actually make the patient experience better as well? Because we all know that when we go to a doctor's office or when we go to a hospital, part of the healing comes from the medication we get, the testing we get. but it's also the way that we're treated. What we're finding through this pandemic is actually how we're treated um, is also becoming a function of the technology that's available to us, because we know that a lot of times today, and we've learned this very quickly over the past many months, what used to be able to occur over a face-to-face encounter nowadays may require an iPad or an iPhone to be able to really have that encounter, that face-to-face that we may want to call. The other thing that I would add is that technology is definitely impacting medicine in ways over the past couple of months that we hadn't thought about before. Certainly as we think about various apps that are available today, whether it's in contact tracing or other methodologies that we're using to be able to fight the pandemic and fight the virus. And I'll talk a bit more about that as the talk goes on. But again, I think that within 90 days or so that we've been dealing with the pandemic head on in a meaningful way, we're seeing quite a bit of acceleration with regards to innovation and technology. Next slide, please. So I practice internal medicine. I'm an internal medicine physician by training for close to 20 years. What I can tell you is that from 10 years to now, there's been incredible changes with how we think about data and how we think about data's application and technology. First, let's just talk about the sheer amount of data that's available. So in 1950, probably dating myself here, and I was not around in 1950, but Marcus Welby and some of those shows that were well publicized in the 50s, 60s, and 70s, physician shows like that. At that time, the amount of number of years that it would take for medical knowledge to double was about 50 years. Fast forward about 30 years to 1980, it took about 7 years for medical knowledge to double. So again, that's the availability of data, the availability of research, and just the sheer volume of health-related articles and information. So in 2010, if we think about that, so 2010, about 10 years ago, was 3.5 years. So let's talk about in 2020 now, 10 years later, how long does it take for medical knowledge to double? At this point, it is 73 days. So we think about the amount of knowledge that's out there, and if that's doubling every 73 days, there is no human brain, and certainly my wife would agree that my brain certainly cannot handle that. But I would actually argue that no human brain can try to not just ingest, but also process that type of knowledge. And that's why I think that when we think about Moore's Law and what that means about computing power and computer chips and what that brings to us, certainly that its relevance not just to today, but also its applicability with regards to the hardware, those are the computer chips, but then also just think about the computing power with regards to artificial intelligence and natural language processing. And why, from my standpoint, as we talk about the next 10 years, that's going to be crucial. Again, just think about that. I'm going to say that one more time. So in 1950, it took 50 years for medical knowledge to double. At this point, we're at 73 days. Now, I'm going to make a prediction about the next 10 years, but I don't want to give the punchline away just yet. So I'm actually going to wait for that until we get to the get towards the end of the presentation. Next slide, please. So artificial intelligence. I have to say that there's a lot that we have to separate the wheat from the chaff nowadays when it comes to artificial intelligence. I always laugh when I see commercials on TV that a coffee mug is being advertised with artificial intelligence. So we know that there's quite a bit of hype out there, but I do think that there's a lot of potential for that as well too. When we think about natural language processing, when we think about what that means from how do we actually build relationships between information, even though some of that may not be ready for prime time, a lot of that is going to be germane for us to be able to build a smarter tomorrow. There's a lot of articles that have been written about, well, are computers and natural language processing artificial intelligence, are they actually going to be able to replace doctors or replace physicians going forward? I actually don't see that as the case. Again, as I mentioned earlier, with medical knowledge doubling in 73 days at this point, what natural language processing and tools like artificial intelligence are going to be able to do is actually going to help doctors be able to do their jobs better. So while it's true that artificial intelligence algorithms and computing power today may be able to read some x-rays, read some CAT scans, a lot of what they're going to be able to do is take care of some of the rudimentary testing that was there. what they're going to be able to do is allow the doctors to free up their time to be able to look at really the complex cases in addition to what the machines are reading, but then be able to add the art that only physicians can bring to that. And I think from that standpoint, AI's impact on healthcare delivery going into the future, especially as we think about diagnosis, is going to be incredibly important. Next slide, please. So clinical decision making is where I think it's going to have the biggest impact as we think about the next 10 years. Let's just take a look at the pandemic. If any of us been watching even one segment of news cycle once a day for the past 90 days, how much have we heard about how COVID-19 presents, right? And all those symptoms are evolving. So just think about, if you miss the news for a couple of days, you do end up missing new information. What if all that information could be placed in a repository that then had access to the computing power of natural language processing or artificial intelligence, and then be made available to physicians? Some of those tools are there today, but I would argue that they're actually in very rudimentary phases. And I think we're going to see a big explosion of that over the next 5 to 10 years, which will again improve clinical decision making, not just in theory, but at the bedside as well too. If we think about automated patient monitoring, we're actually seeing the benefits of that even just during this pandemic. Many of us have been watching the news, talking, learning about how COVID-19 affects the lungs and affects our ability to breathe. One of the first signs that we know that COVID-19 is having a deleterious effect on a patient is when our oxygen levels start to drop. Now we know that, especially with limited capacity in hospitals, a lot of times if a patient is stable, that's not enough reason to be admitted. However, that does warrant monitoring at home. With the ability to be able to use pulse oximetry and other automated patient monitoring, having that connect via Bluetooth or Wi-Fi to our smart devices at home, and then being able to have an automatic alert that's set up to be able to alert a nurse or a doctor or a healthcare practitioner that that a patient's pulse oxygenation level or their oxygen level may be dropping. It's time to bring them into the hospital. Is an incredibly valuable tool that can be used during pandemics and at other times. When we think about population risk assessment, already just a few months into the pandemic, we're already starting to wonder, why are some countries, even if we correct for things like social distancing, if we correct for mask usage, if we correct for shutdowns and slowdowns in the economy, why are certain countries' populations death rates so much lower than other countries? I think that what we're going to find over time is, just like cancer, diabetes, or other diseases, there are other factors that put us at risk, whether those are genetic factors, whether those are environmental factors. And I think as time goes on and we're able to learn that data and be able to collate it, and then be able to use some of the computing power that is not just available today, but I think is coming down the pike, that's going to allow us to be able to use population risk assessment going forward in a much more meaningful way. So as we think about a pandemic that's there today, or we all know that these will unfortunately continue to come down the pike in some level of frequency, even if it's not with the impact that's there today, we know that going forward, population risk assessment, being able to put genetic data, being able to put environmental data, and then pool that with what we're learning about a virus is going to help us understand what should any country do? What steps can we take that'll actually make it more effective for us to be able to fight a pandemic? Contact tracing. We know that up until now, the way we understand the best 3 measures that we have with regards to before we get to the stage of hospitalizations or medications are, one, certainly safety measures such as wearing masks, being able to social distance. Then the second piece is testing, being able to test folks not only just when they have symptoms, but also if may have been exposed or at risk. And then finally, contact tracing. If we look at countries where contact tracing has been started, we're already finding out that before it can get to be very, very effective, we're running out of workers who can actually go and perform the contact tracing, because today, for the vast majority, for the most part, it really is being done one person at a time by single teams at a time. We know that going forward, we are going to have technology applications that are going to allow us to do contact tracing. And in my opinion, that's not related just to this pandemic. I think that's related to even seasonal influenza or other illnesses, infectious diseases that may come down the pike in years to come. Next slide, please. The unfortunate reality for all of us, even though we may feel that, boy, we've just about had it, where we're dealing with not just the medical impacts of the pandemic, we're dealing with social impacts as we enter into debates about whether our kids will be able to go back to school, when will we all go back to work and not just have to resort to virtual meetings. We do realize that unfortunately COVID-19 is likely to be with us for the foreseeable future. Now, none of us really knows what that length of time means. Going by how pandemics have behaved in the past, we extrapolate from that it'll probably about 18, 24 months. Certainly it'd be great if that ends up being much shorter, but we have to be prepared that it could be even longer than that as well. And I mentioned it's having profound long-term impact, not just on how we deliver healthcare, but other aspects of our society as well. And again, I alluded to a couple of those earlier, whether that's school, whether that's work, whether that's even simple things we all used to take for granted, like long weekend travel that so much has come to a halt. All those things that really helped us function as a society and function, with our loved ones. But we do have to say that probably, one silver lining in the cloud, as I mentioned earlier, is that pandemics being, or other illnesses, being the necessity of innovation, we have seen an acceleration of innovation with regards to technology over the past many months. Next slide, please. So if we think about therapeutics and vaccine development, just about every day when we watch the news now, we at least get a glimmer of hope that whether it's somewhere in Europe, somewhere in Asia, somewhere in the US, a vaccine seems to be close to development. If we take a look back at history up until now, the most recent vaccine, the fastest that was developed, the time to development was really 4 years. Now, granted, that was about 40 years ago. I think that, again, today with the innovation that we have, we should not need 4 years. Hopefully that can be much sooner for a couple of reasons. One, we're able to share information much more quickly because of the internet, making information available almost instantly around the globe today. That certainly was not the case 40 or 50 years ago. But secondly, again, just as we think about computing power and what that means with us, our ability to be able to model disease behavior, how do certain cells who are infected with the vaccine, how would they respond when a vaccine is given for prevention? How would they respond if that virus is then introduced after a vaccine is given? Without even having to resort to true in vitro models, we're actually able to effectively try to model some of those just because of the computing power that's available today that would not have been available before. And that's why I do think that this time we should not have to resort to a 4-year wait to be able to get a vaccine. Now, I still don't have a crystal ball. Is that number going to be 3 months, 6 months, 1 year? I don't know. We also have to remember that vaccine development and vaccine implementation are still two different things, right? So vaccine may be developed where we know that one, or we hypothesize that one will be efficacious, but then we have to think about how do we develop billions of doses of that to be able to give that to the masses, the population, which is really what's needed. And then once it's given out to that number of people, regardless of what lab models show or what preliminary studies show, will it be effective in 30% of the people? Will it be effective in 50% of the people? Will it be effective in 70% of the people? Those are the questions that will have to be answered over time. But I do think that, again, with technology of computing power that's available today, we do have the ability to be able to accelerate that in ways that we could not have even thought about 10 years ago. So as we think about disease screening, testing, and containment, I can tell you when I went to medical school, there were just a handful of tests that you could perform in the doctor's office. Most were really done at outpatient labs. Certainly, when we think about COVID-19, it really did start, first, our ability was to be able to test in the labs, which because of the increased demand that came upon quickly because of the spread of the virus, the result turnaround time went in some places from 24 hours to up to about 5 to 7 days. Luckily, we were able to developed new technologies that not only made the turnaround time faster, but also made portable machines that could now be housed, whether it's in hospitals or in employers' offices. And the turnaround time for those went to less than 1 hour. And now there's some preliminary data showing, that there's some at least hope of a test that may be available in as little time with results as a minute. So if we think about the implications of a test that could be mass produced, that could be distributed, that could deliver results of whether a patient is COVID positive or COVID negative within about a minute. Think about that, what that would mean in the workplace. Let's think about what that would mean in the airport as we think about containing the virus so it doesn't continue to spread. And again, without the technology that's available today, that the ability to go from a test that takes 1 day to 7 days to be able to develop one that can now be possibly available with results in about a minute certainly would not be possible. I think telehealth is here to stay. Perhaps won't continue with the adoption that's there today, but I definitely think that that's here to stay. And I'll talk more about that in just a couple of minutes. But I think even from a public and a patient safety standpoint, there's been so much innovation that's happened. We couldn't have even thought about many, about a decade or so ago that we'd have the ability to be able to mass produce and to be able to distribute thermometer scanners that now we can put in buildings, in hospitals, in airports, that instead of trying to take one temperature at a time, which not only would be not time efficient, but also would not be as sanitary as being able to literally have dozens of people walk past a thermal scanner, and then an operative or a person be able to be alerted if a patient is above the criteria for fever that's been set. And certainly we think about supply chain and manufacturing. We know a lot of the challenges that have been there in the pandemic over the past many months. What we think about is with today's ability to have computing power, being able to share knowledge seamlessly, we should be able to get to a point relatively soon where if there's a bottleneck that we're looking with regards to personal protective equipment supplies, or we're looking for testing supplies. And right now we have those centrally located, let's say whether it's with the federal government or state government or with the manufacturer, our ability to be able to level load that supply chain and then be able to redirect the supplies to where they're needed the most. Again, I think that would be a great application for us from a technology standpoint, and I do see more of that being applied in the upcoming months. Next slide, please. So let's talk a little bit about the patient journey as we've thought about it probably again over the past decade. A patient, any of us or a loved one, may leave home. They go to the hospital where they may wait in a waiting room with lots of other people. They may go to the emergency room where they have to then go to testing areas for blood tests or for imaging where they're in various parts of the hospital. Then there probably be, whether it's a ward or intensive care unit, depending on their illness for whatever length of time that's required by the illness. And then at some point they'll be discharged, and hopefully they'll be discharged home, but other times they may end up going back to an extended care facility for rehab or for other nursing. If we think about what a robust hospital safety ecosystem has looked like in the past, it was really somebody just coming by and wiping down with sanitary cloths or with certain light chemicals, because all that was required at that time was that going around the hospital and being able to do that. For us, taking precautions at home and in public was making sure that if we shook hands with somebody, we hopefully not touch our face. But again, we all knew we were guilty of that. We certainly in the past have not washed our hands after we shake anybody's hand, even though today, in today's world, just the thought of shaking somebody's hand seems like kind of a foreign concept. With regards to screening and testing, we were used to sitting in crowded waiting rooms until our name was called. And certainly on-premises solutions were really in very, very limited supply. Next slide, please. So if we think about the alternative that's already exists today, and literally just in the short amount of time since the pandemic came towards us, we've really created a much more robust hospital safety ecosystem. When we think about the precautions at home and health and in public, some of these exist today, and I think some of these exist literally within the next couple of months. We know that geofencing technology is there, right? So if we're able to identify folks that today test positive for COVID or any other disease that's infectious, and if there's an app on their phone which allows then geofencing to notify folks around them, that listen, if you're somebody at high risk, these are the, you don't want to come in contact with these folks. That would, think about what that would do with regards to being able to mitigate spread of a disease. When we think about screening and testing, again, I won't talk too much more about that here, but the availability of a 1-minute test, what that would mean as we think about bringing folks back to the workplace, or as we think about visiting loved ones. Am I bringing something home today? If we have a 1-minute test that we could use just before we enter an elderly family member's home, think about what that would do to make us feel safe and help protect those folks. In hospital entries, again, it was a foreign concept until recently for us to be able to have temperature scanning for everybody. But at this point, I think it's standard fare just about every hospital. Checking in waiting room procedures. I don't think it's a foreign concept for any of us. If somebody asked us, what is the top 10 things in life that we don't enjoy? Probably sitting in a doctor's waiting room would be ranked in the top 10 somewhere. So if we think about some of the technologies that we have today, such as Patient Track, is something that we're using at Jupiter Medical Center. And what this does is allows us to be able to message patients when they're actually ready for their test, when they're ready to be seen for their imaging, when they're ready to be seen by their doctor. So this way, they have the ability to be able to isolate and social distance, whether it's in a car or in an area, until they actually enter into the hospital. So there are no more crowded waiting rooms, sorry. Then sanitizing patient procedure areas. Like I said, in the past, this was really limited to just, using chemical devices or chemical methods. But at this point, using ultraviolet technology, many of which, if you read some of the articles that are in the newspapers over the past few weeks, a lot of these people who developed this technology were wondering how to keep their companies afloat. Now that they're actually wondering how do they produce as many as there's a demand. And again, I think all of these technologies have added quite a bit of value to the way we take care of patients today. Next slide, please. Telehealth has been around for, again, probably the better part of a decade. I don't think we've been able to have as wide adoption as we hope. Some of this was for regulatory reasons. Some of that was, because of issues with reimbursement. But if we think about the biggest problems that plague healthcare today, regardless of the pandemic, even predating the pandemic, are access to healthcare, especially primary healthcare, and then affordability as well. We know that with telehealth, we can actually tackle both of those problems. What's interesting about what the pandemic has done with regards to adoption of telehealth, so the Kaiser Family Foundation did a study which looked at the use of telehealth by employees in large employer health plans. What they found was that the adoption rate by those employees in 2016 was 0.8%. So 0.8% of employees that had access to telehealth actually used it. In 2018, it was 2.4%. In 2020, after the onset of the pandemic, 23%. So we think about a 10-fold increase that's happened literally over the course of the past few months. And why do those people use it? 65% because of convenience. I think we all realize now that as we've gotten used to virtual meetings, it is nice not to have to drive somewhere. And then 63% also not to have to be exposed to potential, illness. So I do think because of that, and now look, CMS and others have already come out and said that they will continue to reimburse for telehealth as the technology has been propagated through our doctor's offices and hospitals. I do think that's here to stay. Again, it may get scaled back a little bit as we don't have to worry about social distancing as the pandemic abates, but I do think it's going to be around for the quite frankly, for the foreseeable future. The only thing that may change it is if we end up getting technology that's even better than telehealth, and I'll talk more about that toward the end as well. Next slide, please. We know that the best way to be able to prevent and spread of infection is to be able to not get exposed to it. So KRAI, which is a thermal scanning artificial intelligence module that we're using at the Jupiter Medical Center entrances, is really one of our core tools with regards to protecting entry, right? So we're able to instantly tell in a completely contactless manner if anybody entering the hospital has a fever. And this definitely helps us reduce the risk of exposure. Makes it much more accurate than the old mercury thermometers used to be. But also importantly, it accelerates throughput. So again, as we think about social distancing, the ability not to have our employees as they come in for shifts, need to congregate because you have to go through temperature, in a very manual way, one person at a time. Now being able to, in a contactless manner, accelerate throughput. I do think that's incredibly important, again, from a disease mitigation risk as well, too. Next slide, please. I talked a bit about testing earlier. We know that as we think about the news, as the virus has ebbed and flowed, and unfortunately it looks like we're again in the proliferation phase of the virus over the past few weeks. Certainly in many parts of the country, that's the case. The technology that's been there from a testing standpoint has been incredibly important. BioFire is something that we're using at Jupiter Medical Center. And what BioFire allows us to do is to use a single test that not only tests for COVID, but also helps us test for other types of viruses and other species of coronavirus as well, too. We're also using the CellX antibody test as part of the participation with the state of Florida Department of Health to be able to look at the exposure rates in healthcare workers, which again is incredibly important for us, not just for today to know which employees may have been exposed, but also when we think about exposure rates and what does that mean in pandemics and healthcare workers going forward. We know that our nationwide testing center system has been overwhelmed. Our ability to be able to fast track tests from the FDA, which I have to give them a lot of credit for what they've done with regards to the emergency use authorization, has allowed our ability. I can't even imagine if we did have a lot of this technology available today, if we only had to rely on the resources available to us through the third-party labs, what the state of testing would be today. I think that would be incredibly challenging for us. I do think that as the rapid testing continues to evolve over the next few months, that's going to be, again, an incredible tool in our armamentarium to be able to stem the tide of this virus as we continue to struggle with that for the upcoming months. Next slide, please. Patient track, I mentioned earlier. So again, this allows us the ability to be able to not have to have our patients wait in a waiting room, whether they're coming in for a test, whether they're coming in to see one of our doctors or nurses, or whether they're coming in for a blood draw. This allows us the ability to be able to have them let us know when they arrive at the facility, but remain socially distanced until they're able to come in and really be completely away from anybody that may pose them any other harm or from other patients. And then obviously there's the convenience of that as well too, right? None of us as caregivers of patients want to have to go in and then being able to try to find and struggle for areas to sit in crowded waiting rooms. The ability to be able to call in when we're needed, I think from a convenience standpoint, is incredibly valuable as well. Next slide, please. Trudy robots, I spoke about this quite a bit earlier. I think this has been incredibly important in our ability over the past many months during the pandemic to be able to disinfect our rooms in a way that only being able to do manually would not have been enough. UV light, the power of UV light, we've heard quite a bit about this over the past many months. Again, using these robots has been very helpful to us, which is why we went from one robot to having multiple ones at this time. And it's also been great from a confidence booster from the staff, knowing that when they walk into a room, it's been not only manually disinfected, but also disinfected using the latest technology with regards to UV rays as well. Next slide, please. Contact tracing, I talked about this earlier. I talked about this from the standpoint of geofencing, but I do think that the use of artificial intelligence to be able to examine, as I mentioned earlier, who are the people that are at the greatest risk, not just of developing a disease, but also passing it on. How does that affect population risk? I do think that going forward, these are going to be, on our phones and really part of our daily lives, not from the standpoint of, I know we always have concerns about Big Brother watching, and obviously important protections will be have to put into place to make sure that all our privacy is protected. But with that being said, for our ability to be able to protect populations at risk, that will also be important to be able to expand contact tracing by using them as apps on our cell phones or on our smart watches. And I do think that's going to be on the horizon within the next few months. Next slide, please. So just in conclusion, what I would say is, I've always been someone who's enjoyed technology. Actually, when I was in college, had the hard choice of thinking about biology versus computer science. I ended up, venturing into biology because at that time I ended up enjoying it more. But I think the technophile part of me has always stayed with me and always enjoyed that. Actually, recently completed a certificate in artificial intelligence in MIT because I really wanted to understand what the applicability of natural language processing and artificial intelligence is, in medicine. So the last comment I'm going to make, which is starting the first slide, is, where do I think this is headed over the next 10 years? So if we think about going to the doctor's office today, where the doctor many times will look at our medical history, we'll have access, if we grant it, to our patient's medical history, to our parents' medical history, our family's medical history, and say, boy, based on these two pieces of information, here's what your risks are. So if two of your patients have diabetes, you may be at risk for diabetes. Let's extrapolate that a little bit further. As we think about how much has been made, progress has been made over the last few years with regards to genome sequencing. So there's a big genetic component. We all know this, right? So whether it's our susceptibility to cancer, whether it's susceptibility to infections, whether it's susceptibility to heart disease or diabetes, we know genetics plays a big role. We also know that our environment. So do we live close to highways where there's a lot of pollution? Do we live close to areas where there may be certain chemicals or certain pollutants? How does that play into our health? All these various pieces of data live in disparate silos today. I do think that as we start to now have the ability to be able to store massive amounts of data and then be able to process it, I think it's really akin to a three-legged stool, where the one part, which is the phenotypic data, which is what is our family history, what is our own history, that lives in our electronic medical records. Then what is our genomic data, which is our gene sequence. What does our genetic predisposition put us at risk for? And then finally, what is our risk from the environment that we live in? Are there certain things that put me at risk from being in Florida that I may not be in risk of New York, or certain things that put me in risk of New York that I wouldn't have if I lived in California? Certain environmental factors. All of those pieces of data that now, with the computing power of natural language processing, artificial intelligence, cloud computing, I do think that that's going to allow us to make meaningful connections in data that we weren't able to before. And I would suggest that over the next 10 years, that's going to have immeasurable effects with regards to improvements in how we think about diseases, how we treat diseases, and mortality and morbidity as well. With that, Joe, I want to thank you for this opportunity today.
Well, Dr. Rastogi, thank you very much for joining us today and sharing everything that you did here. I mean, some of the knowledge, the fact, I believe, what was it, 73 days that medical knowledge is doubling now?
That's correct. That's correct.
We use that term in technology too, to think about the amount of information that doubles, and it's constantly exponentially getting more and more closer to minutes than ever before. But it's really impressive to hear about and see what Jupiter Medical Center is doing, and what you've done just to even educate yourself as a leader to take care of those right here in our own backyard. So I appreciate you and thank you for everything that you're doing here during this time. One question I would have is, what is one technology innovation in the medical and healthcare space that you're really looking forward to? Something that, maybe not it's Jupiter Medical Center, maybe it's something that is so up in the clouds of an idea right now, but something that might get you really intrigued about the invention or the innovation of it.
It really is, and I talked about this in many ways in kind of broad terms around artificial intelligence, but really being able to now hone that down. So as Joe, again, as you alluded to, how quickly, even in technology, how knowledge is doubling, knowledge is increasing. But up until now, for the most part, all we've been able to do is through cloud computing, be able to actually store that, right? So before we couldn't even store it, but now how do we get to the level of big data being stored to now being able to make those connections and make those inferences? And I think that, from my standpoint, is really what I think will be the next big breakthrough. And I'm excited to be part of that because hopefully I'll be around for at least a little while longer. So I think that within my lifetime, and then quite frankly, much before that, we'll be able to see those dots being connected, which I think will add not just to our lifespan, but to our lifestyle, right? Because what all of us want to do is not just be able to live longer, but live a much healthier lifestyle and a great quality of life. And I do think that the ability of, and look, there's so many folks, whether it's Google's DeepMind, others that are doing with regards to artificial intelligence, that I think is going to bring a lot of this to the forefront in healthcare for sure, in the upcoming 5 to 7 years.
Yeah. Well, with that, we're almost at time here today. We had about 50 people tune in on Facebook with us for your talk today. So I do want to thank everybody for tuning in. And for those that do want to learn more, about Jupiter Medical Center, I believe it's right there on the screen, jupitermed.com. They have a great team that works out in the community as well. Want to give a shout out to Lou Hughes, who helped piece this event together, who's on the JMC team over there. And again, a shout out to all of the doctors, the nurses, the medical staff who have obviously been working into some very interesting and perilous conditions of late with our entire community. So again, one last thanks to them. And again, thank you very much, Doctor, for joining us today. I hope you have a great rest of your week and a very good months and years ahead there with Jupiter Medical Center.
Thanks, Joe, and stay safe.
Will do. Have a good one.